Local fire officials are working on a more cost-effective way to provide you with emergency services, and we're going to tell you how this benefits you. Coming up on CityWorks. Welcome to CityWorks. I'm Valerie Starn. Today we're talking about a more cost-effective way to provide emergency medical services. Joining us now is the Fountain Valley Fire Chief, Tony Coppolino. Welcome.
Hi Valerie, how are you today?
Fine, thanks. This is technically the official title of this program, Alternative Destination Program. Now that doesn't sound so friendly, and it doesn't necessarily sound like it's something the public would get excited about, but they should. First of all, explain how this program came about.
Okay, Valerie, yeah, you're right. It sounds a little bit intimidating when you just call it an alternate destination project. And really what people have to understand is the fire service is pioneers in looking at other ways to do business and take care of our community. And really what we want to do is make sure that we're doing things cost effectively, doing the right thing for people, and getting them the right type of care as quickly as possible. So when we talk about the alternate destination pilot study, it's a pilot study that's a statewide study. There's 13 different pilots within the state of California. And some time back, approximately 2 years ago, the state put out an interest flyer on different fire departments or emergency medical services agencies that were interested in participating in the pilot study. So the cities of Fountain Valley, Newport Beach, and Huntington Beach had an interest. We submitted a letter of intent, and we were chosen. We are one of the cities by the state EMS board, Emergency Medical Services Agency, which essentially that agency regulates at a state level how pre-hospital medical care is delivered to people. So we were chosen as one of the 13 pilot studies in the state to participate. And essentially what it boils down to very simply is we are testing the paramedics, our current paramedics in the field, with limited training to see if they can triage people of low medical problems in the field and transport them to places other than the emergency department. We've recognized over time that the emergency departments are just so impacted with patients. And a lot of times—
When you say emergency departments, are you talking the emergency room?
The emergency room, yeah, exactly.
Not a place people like to go because they know they're going to spend a lot of time there.
That's very true. And the other problem with that is way back in the late 60s, early 70s, the system was really built that that's the only place that fire department paramedics can take people that enter the 911 system.
Isn't that still the case today pretty much?
That is the case today.
If you get in an ambulance, that's where you're going.
That's exactly right. And that's essentially what this pilot study is testing, is to see if the medics can triage people, realize that they have a very low acuity medical problem, such as maybe a sprained finger or a small laceration, and take them to a place other than the emergency department. And essentially where we're taking them is urgent care centers. So these urgent care centers have been trained, they've been inspected by the local emergency medical services agency, and they have to meet certain regulations and certain medical standards for them to even qualify to be part of the pilot study. So we've partnered with actually five different urgent cares, and they went through this evaluation process, and they've been deemed capable to receive the patients that we include within our study.
Just to backtrack for a moment, when did this idea first come about, and what was wrong with the system that was in place?
So we started working on this at least 2 years ago. I would guess it's probably more like 2.5 years. And it took us almost 2 years to really put the structure of the pilot together. And then we actually implemented the pilot in late September. So a lot of planning and a lot of care was taken to go at great lengths to make sure that it's a safe study, make sure that we're not doing something that would put anybody at risk. And then it took time to train the paramedics. And then it also took time to do the review of the urgent cares that I talked about, and then afford them training as well.
Where is the pilot program now? What happens next?
So as I stated, we started back in September of 2015. We're about 5 months into the pilot project, And essentially what we're doing is collecting data. We're enrolling patients that are appropriate, and then we follow these patients all the way through the process. Our pilot is really neat in a sense that because of the electronic era that we're in today, we have this ability through our patient care records that are all electronic now. As soon as a patient's consented, it actually pages two of the physicians that are participating and are partners in the study. So it's really neat because the physician can log on and actually watch the patient go all the way through this process, from the consenting process to the time they get delivered to the emergency care department, and then what their ultimate outcome is.
If we didn't live in this digital age, in your opinion, could you be doing what you're doing right now?
We could be doing this, but it would take a lot more people, because really, because of the digital age, a lot of things happen in the background that's happening because of the computer.
So before, it was all done on the radio, is that right?
Actually, it was all done in paper pencil. So the paramedics would chart their records on with pen and paper, and then that would get submitted back to the department. Then a person would have to actually review that and then input that information. Now we have electronic patient care reports that everything happens in the field on a tablet. And the paramedics enter the stuff, and it automatically gets sent off to the cloud, and all the patient records are available to those that are appropriate to see it.
Let me go back also to when I first started this conversation with you. I was asking about the program because when you say that the fire officials are looking to be more cost efficient, you know, a patient might say, well, wait a second, no, I want the best care. But really, that is the basis of this program, doing care in a better way. Yeah,
Valerie, that's correct. And really, that's something we should probably really dive into a little bit here. Because when we started the pilot, one of the things that we got feedback from the community is they didn't want to be taken to a place where they perceived they were going to get lesser care. Well, that's not the case. We would never take anybody that we believe is maybe having some type of a heart condition or some type of an acute medical condition to an urgent care. The urgent care is capable to take care of certain medical problems. And essentially, as I stated in the beginning, it's sprains, it's small contusions, it's very low acuity medical problems. So if you have an acute medical problem, you have a medical problem that the paramedics deem as something that's serious, you would never even be considered as an urgent care candidate. You're going to go to the emergency department and still receive that high level of care you always have.
And Chief, I have some more questions about how this process works, the evaluation process, as well as everything that it takes to implement this new program. But right now we have to take a quick break. We're going to be back with more CityWorks right after this.
Emergencies and disasters can happen with little or no warning. Often, they may occur when you're away from home. El Nino-related storms put Orange County at risk for flash flooding and strong tidal surges along our coast. Protect yourself and your family by signing up for early warning notifications with Alert OC. Instantly receive notifications by phone, email, or text. Don't be caught off guard by this year's El Nino. Sign up now.
Because play might be the best way to fight obesity.
Because staying connected makes my family stronger.
Because a safe place after school can lead to success in school.
Because physical activity is vital to my health and well-being.
Because I need to make my world better.
Because playing team sports teaches character and social skills.
Because we need each other.
Because we need each other.
Because we need each other.
Gaining weight was easy. All I had to do was sit down and eat. Losing weight's a lot harder. I have to work at it every day. But with every step, I lower my risk for type 2 diabetes and heart disease. And that makes every step, every choice, every day very much worth the effort.
Hi, hon. How was your run?
Hard, but I hung in there and did my 2 miles. How was your workout?
Great. Dinner's ready. I hope you worked up an appetite.
Healthy meal like this, you better believe it. Thanks for keeping us on track.
Hey, every step matters. We can do this.
And it's very much worth the effort.
Learn how you can help stop diabetes by losing weight, eating healthy, and staying active. Visit checkupamerica.org or call 1-800-DIABETES.
I'm Peter Gallagher. Infantile scoliosis is a potentially fatal condition that is curable if treated under the age of 2. Don't wait. Visit infantilescoliosis.org. When you save a life, you save a world.
I will keep dancing on point, even if it hurts.
My arm is killing me. I don't know if I can pitch another ball, but I'll just play through the pain anyway.
I have to do the big stunts. We'll look better than the other cheerleaders if our tosses are bigger.
My elbow really aches, but I got to keep practicing.
Nearly 50% of all sports injuries sustained by middle and high school students are from overuse. Don't play through the pain. Visit StopSportsInjuries.org.
We're back with Fountain Valley Fire Chief Tony Coppolino, and we've been talking about a pilot program that is looking at providing your city and surrounding cities with a more cost-effective way to provide emergency medical services. And we've also discussed that concept might be misleading. It's not so much the emphasis on being cost-effective for you, but better care for your patients.
Yes, it is. We always are looking for different ways in the fire service to provide better care for our the communities that we serve. So some time back, as we talked about with when the state put out the flyer of interest for agencies that would be looking to participate, the Orange County Fire Chiefs decided this would be a great pilot study to participate in. And really what we're trying to do is take paramedics and firefighters in the field that exist already. And what we did is we gave them an additional training, approximately 16 hours of training, on how to identify low acuity patients that could qualify to go to an urgent care.
Now, wouldn't this be something that would already come with training to be in that field? Or what other things are they now looking for?
Yeah, that's a great question. And I think what we really have to realize is daily, 24/7, 365 days, the paramedics in the field are triaging people every day and taking them to specialty centers. They're looking at very sick people, and they're looking to take them to a trauma center, a stroke center, a cardiac center. So really, when we first started looking at this, we thought this is a great pilot study for us because the paramedics are already doing this. So what we needed to do is give them more training to look at patients of lower medical problems and make sure that they can filter those people that could potentially go to those urgent cares, because they're already triaging people that are very sick and have very severe medical problems. So we put together a training program, as I said, that was approximately 16 hours, and we gave them a little wider breadth of knowledge on how to really core into somebody's medical issue and decide that it's something that could go to the urgent care.
You know, a lot of folks watching this program have never had to dial 911 for either an emergency or due to a health issue that they all of a sudden realized they couldn't manage at home or get themselves to the hospital. So having said that, I just want to ask you to kind of break down what your medics see all the time. This is their daily job, but again, something a lot of people are completely unfamiliar with. Obviously, if a person feels like they're having a heart attack, but what are some other situations, maybe in the home, where somebody's going to call 911? Either they should if they're doubting,
right,
or they should because they can get the right kind of care, especially with this new pilot program.
So that's a great question, and I think the best way to answer is let's run through a scenario. So let's say you are at home by yourself and you trip and fall, and you just are starting to experience a little bit of knee pain, but nobody's home and it's really bothering you. Now it's to the point to where you really think you need some medical care, but again, there's nobody home, you don't feel comfortable driving, so you should always activate 911. We're here for that reason. We'll come out, the paramedics would evaluate you, and they would realize that really you have a fairly low acuity medical issue, but it's not quite something you can deal with at home. So what they will do is then transfer over into this consenting process. And it's something that we drafted through the help of our one of our partners, the UCI Medical Center, and through the physicians and the local emergency medical services agency, we drafted a consenting process. And essentially what it does is the paramedics go through this process and they ask the patient multiple questions, and one question leads to the next. And essentially you can't get from one question, you have to answer that question, I will say, correctly, but correctly to be consented into the project. And if not, and it goes to the other side, then you automatically would go back to being transported to the emergency department. So as we go down this consenting process and you get all the way through this, the final question is, you qualify to be consented into the alternate destination pilot study. Would you feel comfortable going to an urgent care to receive care? And if your answer is yes, then you go to the urgent care and you receive medical care there.
Now, prior to this, would that person have had to have gone to the emergency room?
That's correct.
So if I am in that situation and I'm home and my knee is causing extreme pain and I need help, but I don't want to call 911 because I don't want to go to the ER.
Right.
So this is something that as a resident, I'm going to really look forward to, it seems to me.
And that's a great point, and that's one of the things that the fire chiefs, myself and Fountain Valley and Huntington Beach and Newport Beach discussed. And the great thing about this pilot study is we're now giving people a choice. It's not like you have to go to the emergency department. If this pilot study is successful in the future and we're able to change state statute, people will have a choice now on where they can receive their medical care.
It sounds like a great plan and the pilot's going well, but all good ideas come at a cost.
That's right. Yeah.
So how is this being funded and what are the costs involved?
So we've been very fortunate. We've had sponsors from multiple hospitals in the area. So one of them is the Hoag Healthcare Foundation. The other one was through the pilot study, as I mentioned, through the state. The healthcare agency was another one of our contributors, and we're still looking for funding. We're about 2/3 of the way there, but we are still looking for funding to finish off the project. The project's estimated to go for at least 2 years, and we continually look for that final piece of that 1/3 of the funding, but we are very fortunate that we've been able to find the funding that we have so far. So it's really important for people to know that it really isn't costing the taxpayer anything. It's all been funded from the different hospital organizations.
And one more thing I want to ask, since the pilot study is continuing on for, how long did you mention now? It's still going to...
The pilot study is slated to go for 2 years.
So if I'm a resident of Fountain Valley, Huntington Beach, or even Newport Beach also participating in this, if I happen to call 911, am I eligible for this study?
Yes, but as I said, it's important to realize that there is a fairly rigorous consenting process, and part of that is because we want to ensure that we're really looking at the right person with the right medical condition going to an urgent care. So, but yeah, anybody that dials 911 that ends up having what we determine a low medical problem, what we call a low acuity problem, is eligible to participate in the pilot study.
So I'll have you reiterate, what would you like residents to know about this program if they may experience an emergency situation or a lesser emergency situation of their own?
I think really what's important to know is we're trying to engage with what's going on with the Affordable Care Act and the changes in healthcare. We're trying to foresee what's happening in the future. And the fire service wants to keep pace, and we want to be part of that change. So I think what's important to know is, one, we want to be part of meeting the triple aim, which is getting people to the right health care in the right amount of time and to the right place. And I think that, as we talked about before, the other very important component of this is people have a choice. You'll now have a choice of where you can receive medical care. And part of that choice is, in 2 years, if we really find that this is very successful, it could be very economic as well. There could be economic benefits. So we did a quick survey of what the cost of going to an emergency department, say for a fractured arm, versus going to the urgent care. The urgent care is approximately a third of the cost of going to the emergency department. At no fault to the emergency department, because they're required to have such a high level of care 24/7, 365 days of the year. But what we're trying to do is really filter out those people that could go to an urgent care that maybe doesn't have to have quite the stringent requirements that an emergency department does and receive the same care. So the person that goes to the emergency department with, say, a fractured arm might be splinted and then sent to an orthopedic specialist the next day. And that's the same exact service that they would receive in the emergency department.
If you are as successful as it sounds like you intend to be with this pilot study, how soon might it roll out to other departments and it becomes the standard?
Yeah, that's a great question. And the answer is, I'm not really sure. Because what's going to happen after this is the state will take all the information they've gathered from the pilot studies, will analyze the data, will put together a position, and then we'll offer that position to the state. And then ultimately, what we're trying to do is drive statute changes so that we can legally, essentially, outside of a pilot study, take people to places other than the emergency department.
How does it feel to be at the forefront of this?
This is great, right? We're really excited about this. It's been a lot of work, but I think that you've got a committee that's so engaged, and we're so looking forward to being really pioneers in changing the way people can receive health care that it's just exciting.
Well, and thank you for sharing all of this with our viewers.
Yeah, thank you for having me.
We've been talking with Fountain Valley Fire Chief Tony Coppolino, and a great new service that's going to be coming soon for all of our residents. And thank you for tuning into CityWorks. I'm Valerie Starn.